Sarah, hello.
Hi there. Thanks for having me.
Stephanie, welcome to Blue Sky.
Hi, thanks so much.
I want to hear from both of you because I know you're going to be speaking at that rally in front of the legislature today. I want to know more about what made you want to speak out. Sarah, I'll start with you.
I think it initially started with how the morale in my workplace is right at the current moment, and for the last 5 to 7 years has been deteriorating. I'm seeing my new and novice nurses just being completely distraught with their working conditions, and I felt that as someone in a leadership position as a charge nurse, I really needed to work on their behalf to create change.
What are the changes that you've seen in the last 5 to 7 years? What do things look like now compared to before?
I'm seeing increased and consistent use of hallway spaces. We're doing more waiting room medicine in terms of emergency medicine. We're doing all of our treatments and therapies out of the waiting room because we are so bed blocked in the actual department that we're not able to bring emergency medicine into an appropriate care space.
You said that some of the younger nurses are distraught. That's a pretty strong word to use.
Yeah. Well, when you're having nursing ratios like 1 to 8, your patients are there's OBS level criteria in terms of monitoring these patients. We're talking very sick patients with nurses who don't have a lot of experience, but compound that with they don't really have anyone to support them either. Our venture nurses have left because our working conditions are so horrible. So it leaves these novice nurses in a very precarious situation where they're caring for the sickest people in the province, but they don't have the mentors to help them grow in those situations. So they're left feeling hopeless and lost and scared for their license and scared for their patients.
Stephanie, what are you seeing? What made you want to speak out today?
Pretty similar to what Sarah said. I've been in St. Paul's Emergency for 15 years. So I'm one of the long-standing nurses there as well. We had a stable group of senior nurses with very experienced, practical, hands-on leadership that we're able to mentor our new nurses coming in for years. And we've slowly dwindled down and they've left in droves. Are
they retiring or what?
They're retiring. They're going to easier jobs. I mean, all nursing is difficult, but there's the emergency, we don't ever reach capacity. We accept everyone that walks through the door. So unlike other departments in healthcare, you fill up all your spaces and then they say, no more. We've reached capacity. We can't take any more. And then that influx, anybody else who comes in that doesn't have a bed, fills up all of our emergency departments. So when we talk about having to house admitted patients, my department is 33 beds. Sometimes we house admitted patients that should be on wards, and we've gone up to into the 40s having to house that many people. So we have more beds that should be admitted, patients that should be on wards in different areas of the hospital where they can safely care for them. They have resources like wound care and physio and things that they need to actually get better, and they cannot get that in the emergency because we have stretchers. We don't have beds. So these patients are stuck in hallways for like 7 days. They don't get the adequate care they need. We are not trained in that. And then, as Sarah mentioned, all of our emergency care is happening out of our waiting rooms. So you come in with a heart attack and we don't have an emergency room for you to be treated out of. We treat you out of the waiting room unless we have to send you directly for like surgery or emergency catheterization. We have to sit you in a chair and start your IV with everyone around you. There's no privacy. There's no way that our triage nurses shouldn't even be giving care, and that weight is on them. And those are our senior nurses that are leaving. So not only have we lost these like super valuable emergency nurses that we need that experience for to be able to grow up our baby nurses to become very functional, experienced, great emergency nurses, they've all left because the working conditions are unbelievable. The moral injury is insanely high. I myself went casual because I couldn't take it anymore either. I'm now in a different position that I'm the clinician. And as the clinician, my job is support of my department. I want to be able to help these nurses, and I want to be able to get back to giving good care to the patients of Saskatchewan. But I was driven to speak out because I can't do my job in the current situation. There's no way. The solution we need is actual acute care beds where these patients are not in the emergency department, that the wards in the healthcare have adequate nursing and adequate resources so they can safely care for those patients. And then we can get back to treating your heart attacks and your strokes and your traumas and all those things. And those are the people we're failing right now. And that's why healthcare staff are leaving, because we take on that weight. We look those patients in the eyes and we see the distress that this causes our patients, and it weighs on us. And so the nurses can't take it anymore.
Stephanie, what was your tipping point? Did something happen that made you realize it was time to get out of there?
I mean, I think the pressure's coming from above of like what was expected and what, like there's always pressures about like retain your staff and educate your staff, and there's safety alerts that come in that we have to then follow up with. But it all leads back to system problems. It's nothing that we can actually tackle. Our departments and our managers and our great leaders on the floor like Sarah, our charge nurses, have done everything they can. They've coped for years, and we're great. We're super resilient.
I think that's our own fault, right? It was like we're double-edged sword. We're so good at troubleshooting. We're so resilient. We're so resourceful that we've padded the problem for so long that now it's just we've run out of even our own ability to do that. So if we don't get extra support and if we don't find solutions that create real change and real opportunity in our nursing working conditions, then I don't know what is going to happen to the patients who are coming into our emergency departments. On Tuesday, I was at 350% capacity. I ran out of oxygen. I couldn't find a stretcher for a patient. Like, these things are the baseline for providing care, and I couldn't even get that.
And emergencies are the safeguard of the public. Like, the risk to the public is huge when the nurses are pushed to this. And like, emergency staff are so resilient. We're great at just rolling with stuff and figuring it out, but we've been pushed beyond the limit and we cannot anymore. And we have been calling out for years. And I think it just pushed us. It was either like, try do this and risk speaking out, or quit at this point.
And I want to make my team proud. So I know that they're struggling, and I have the ability and the capacity to do something. I think that it then becomes my responsibility to do something for them. And I have a niece who's trying to be a nurse right now, and she's going to get crushed under the weight of this system. She's a sensitive, caring little girl, and I can't bring her into this. I've got to do everything I can to protect her. Not only just protect her, but protect my patients.
So, Sarah, what can you do? There's two sides of this. Like, what do you feel you can do, and then what changes, what ideas do you have that would make things better?
So, first of all, we need to invest in our peripheral care, our health care. We need to create a situation where we can retain and recruit nurses into our periphery so we can expand access to care in our smaller rural facilities. So then we're not completely centralized in our urban Saskatoon areas or Regina areas, because I think that's where we're seeing a lot of our congestion, all of these consults coming in to our emergency room because they don't have access to those specialties out in the periphery.
Like rural areas. You're talking about, when you say periphery, you're talking about everything outside of Saskatoon and Regina?
Correct.
Yeah.
So even the smaller communities outside of Saskatoon, so Watrous, Outlook,
Rostern,
Rostern, yeah. So all those places, they don't have a breadth of services that they can access. So if those patients are requiring something more than that's available in their community, they're sent to Saskatoon, and then those physicians see those patients and they admit them to our hospital, and we just see this cycle of of patients being brought to Saskatoon, admitted, and then you just have the numbers increasing because we have such an obstructed outflow of patients out of the emergency department. There's no reflux valve. There's no pressure relief.
There is no plan for emergency situations. If a code orange or something was to happen, we're in all of those extra spaces where we could decant the emergency to be able to respond to something like the Humboldt bus crash. There's no plan, and upper leadership is aware of it, and it's terrifying. It's terrifying that we're aware that we're in this deficit and we need more space to be able to house people in the meantime while problems are being fixed with internal processes or whatever that is. And so the weight is on us in emergency, and it's absolutely terrifying to every emergency nurse.
So you're both looking to politicians that are currently on the campaign trail, right? Like, you're taking your message to the legislature today, but you also, I understand that just before coming to our studio, that you nurses had scheduled a meeting with both the current Sask Party health minister and the leader of the NDP, Carla Beck. But only the NDP leader, Carla Beck, was there, right?
Yes.
So I want to know what the atmosphere was like at that meeting, especially if there was an expectation for the Sask Party health minister to be there and then that person was not there. So Stephanie, do you want to tell me a bit about that?
Sure. So Carla Beck spoke with our nurses at our provincial Ed Day in Regina here today, and she was able to lay out what the NDP's healthcare platform is, and I think was very relatable. I think a lot of the solutions, including making sure that healthcare experts that are on the front line are involved in decision making, and that is kind of what we really have not seen. There has been a lot of upper level decision making that is inapplicable to frontline and without any knowledge of what actual frontline work is.
Right. And
that's been the reality with the current government. And we were told that Everett Hindley, the health minister, was supposed to be there this morning. Apparently they had confirmed that was the plan, and without any notice, he did not show up. They tried to contact the Premier's office, and he was a no-show with no warning.
So how did that affect the morale of the room?
I don't know how surprised we were, to be honest with you. The blatant disrespect that we've gotten from the Sask Party is, we were like, oh, well,
par for the course.
Yeah.
It's been a lot of lip service. I myself have been in meetings
after
we've tried. We've sent letters, we've rallied, we send emails, we follow the chain of command that we're told to within our processes, and it's a lot of lip service. It's a lot of maybe a little bit of low-hanging fruit, things that they will dangle and try. Like, we get our hopes up, and then it's even more morally distressing when nothing comes through, and we just get worse and worse and worse. And RUH reaches numbers of 350% capacity.
Or they give you the same rhetoric every single time, right? Yep. Like, oh, we're doing our capacity action plan,
We're bed mapping.
Yeah, we've got more analysis coming, but nothing ever comes to fruition. We never see change. We only see things deteriorate.
We really need solutions. We're desperate for ourselves and the patients in this province.
Yeah. And we do, it is a terrible, terrible situation, but I want the people of Saskatchewan to know that we have their backs. If you need help, if you need care, if you're sick, we are here for you. But we have to fight for something better because you deserve better.
We are absolutely trying our best. Our teams are so resilient, and they work so hard.
So dedicated.
The conditions are breaking them down. So we need engagement. We want the public to know that we're trying to take care of you. So please help take care of us.
Yeah.
How many of you are going to be at the legislature? Your voices are coming through loud and clear today.
What did they say, 400?
I think 400, but they also, I think there's some teachers that are going to be there.
Yeah,
I think they're trying to get the public involved. So
please come out.
Yeah.
Okay, we'll leave it there for right now. Good to talk to both of you. Thank you.
Thank you so much.
Us.